Hey guys, Dr. Sean here. Wanted to make a video today about when it is most appropriate to see a chiropractor, because that's a question that comes up quite often, and it's one I feel like obviously people can go one of two ways with when they try to or make the decision to pursue care within a chiropractic office. And I think one of the things that you have to consider is how important is your health or the way your body is functioning to you. And what I mean by that is there are those out there that are very health conscious, and because they are active or they enjoy an active lifestyle and they want to take it upon themselves to be as healthy as possible, and when they start to feel certain things within their body, whether it's restricted range of motion, they feel tight, their body feels off, and they don't necessarily want that to escalate into more debilitating, more severe symptoms such as pain or potential injury, they'll make that decision to get out in front of it. And by getting out in front of it, they hope to avoid something more serious getting in the way of just kind of, in general, their lifestyle and their quality of life. So that is their decision. A lot of times that's why they walk into our office, especially if they've come to know us and they trust us and they know, like, hey, I know if I see you and you're able to handle this appropriately, it's going to save me a lot of headache down the road. No different than if you had your maintenance light come onto the dash of your car and you can choose to do something about that and get it in and make sure, okay, hey, maybe I need my fluids topped off, maybe I need the oil changed, or maybe there's potentially something else going on that maybe a little bit more of a fix, might be a little bit more out-of-pocket expense, but if I handle it now, maybe I'm going to save myself a larger expense down the future. So there are those also that same dash light comes on, they will ignore it and put it off, and then they really start to run the risk of, okay, well, are you potentially going to make something worse and deal with more of a headache than you possibly could have if you would have got out in front of it to begin with? And the reality is the same thing could be said with the human body. A lot of times we get these little warning signals. It could be tightness, it could be restricted range of motion or some sensitivities, or you start to notice things aren't quite right in your body. Some of us choose to ignore that and just push through, hoping that they'll go away. And sometimes they do, and sometimes they don't, and then maybe they'll get worse. And if they start to get worse, even still, that's not enough. A lot of times some people will come into the office and they're broke, they're hurting bad. They might even have an injury associated with it. And it's maybe just a little bit longer of a road back to getting them healthier, and we can get them there. But maybe they would have saved themselves a little bit of time and out-of-pocket expense. Because reality is most people now, when it comes to chiropractic coverage and their insurance, they are going to have out-of-pocket expense. So regardless of time and money, and those considerations have to be made, but you might save yourself headaches and a little bit more out-of-pocket expense if you take it upon yourself to get out in front of certain things before they get worse. And so that's two ways you could go about it. You could take your time with it, see if it goes away, or you can make that conscious decision to say, hey, I'm going to see somebody about this. But when you see someone about, ultimately what somebody wants is someone that they trust, they know that they can get results with, and they know they're going to get a good matter-of-fact opinion on, and feel like that's something that they can fall back on. Now, for a lot of people, they will go see their medical doctor when it comes to, your everyday aches and pains and stuff like that. That seems to be the number one place to go. Back pain, neck pain, whether it's joints like shoulders, hips, knees. A lot of times the first point of access is someone's PCP or medical doctor. Well, PCPs and medical doctors oftentimes will simply prescribe maybe some anti-inflammatories, muscle relaxers, maybe a script for physical therapy. They don't really give too much to you in a sense of, other than maybe, hey, take these, maybe stop doing the activity for a period of time, rest, and then here's some therapy. And not that therapy is all bad, but for a lot of patients, they may go in to physical therapy and get evaluated, but then just some of them can be left to themselves just to simply do stretches and exercises, and they aren't getting the supervision or the guidance that they were hoping for. And that's where I feel like a chiropractor who has a rehab or a sports background, who's well versed in some of those techniques, and really becomes more of a movement specialist and a movement expert, can help you when you're dealing with a lot of those conditions that may be fairly benign, again, just general tightness, range of motion restriction, all the way up through more serious things like pain and injury. Because what you want is, whether it is, again, a physical therapist, a chiropractor, sometimes even if you're working with a trainer or somebody from an exercise standpoint, you want them to be well versed in human movement and human function. And if they don't have that, you're not going to get the gold standard of care that you're hoping for. And you're not going to find that you're getting long-term relief, because the number one intervention when it comes to joint pain and it comes to outcomes, the most successful outcomes come from exercise. And that's exercise that's done well, and it's done from a therapeutic sense, and you can progressively build somebody. Because as healing and as therapeutic as exercise can be, it can also be very damaging. And there's plenty of people out there that have experienced that, unfortunately, where they've been working with someone that maybe doesn't know quite what they're doing, and they ultimately get hurt. And that's an unwanted side of exercise, and even in a rehab setting, which also comes down to exercise and movement. So whether you're pursuing some sort of care for, you're getting meds, or you're getting anti-inflammatories, or you're getting injections, or possibly there's a surgical intervention that may be needed, if you look at all those and you compare them to exercise, while some of those might pan out to be quicker in the short term in terms of relief, nothing is more successful than exercise in the long term. So if you're looking to make some sort of substantial change within your body, you have to go the exercise route. And that's where you need someone that's going to integrate that into your program. From a chiropractic standpoint, we can do some great things with joints, with mobilizations, adjusting. You can do great things with the tissues around the joint, muscles, tendons, ligaments, through various soft tissue techniques, myofascial release, active release, Graston, or instrument-assisted work. But all that said, and as effective as those things can be, you still need to make someone's body change for the better through exercise, and that has to come into the picture. And so when someone's dealing with a lot of the stuff that we're talking about, aches, pains, and so on, ultimately what they're going to hope to find is some sort of long-term solution. They don't want to recurrently deal with the same things over and over and over again. A lot of times people fall into that, whether they feel like a certain area in their body is a chronic issue. Again, it could be a shoulder, an area of their back, could be a hip, could be a foot. They can get the treatment that they need, but if they aren't necessarily handling it from an exercise standpoint and making sure that they are making change in their body through exercise, this is why a lot of times these things start to become problematic over and over and over again. So if you're looking for someone to actually help make a change, start with looking for a provider. Gallagher Performance is a great place to start. Shameless plug, but it's the truth. If you're in the area, this is what we specialize in. If you're not, find a provider that's going to help you figure out what are the best strategies to help you get out of pain, to help reduce tension in your body, within your muscles, to help free up the range of motion in your joints, but then also what can you do from an exercise standpoint to help keep you there, help promote your body feeling as great as it can for the long term, and then for you to be able to enjoy basically the quality of life that you want to. So hope this was a helpful video. Thanks for listening, guys. Have a great day.